There's always two basic ingredients to research and/or innovation: curiosity and persistence. You get to play out what you think is a good way to move in terms of advancing the field. I'm born and raised in the Bronx, New York City. My dad was a physician, so that helped form some of the early experiences. I was always interested in science. I always thought I was going to go into medicine. I picked a residency program that was very, very academic, especially for orthopedic surgery. I had this dual life of being a clinician and a research scientist. I ran my own lab in cell biology for many years. I learned from that experience how you go from research, understanding what a gap in knowledge is, and then how you translate that into an innovation or a new treatment. My contribution has been in the area of preoperative surgical planning, particularly in the area of shoulder arthroplasty, but more importantly, all of the enabling technology that takes that digital data that you can get from three-dimensional planning and translating that into how do you bring that level of precision and accuracy to the operating room. There's a team of us that developed it at Cleveland Clinic in the early 2000s. It took about 7 or 8 years to get the technology from the lab to FDA approval and to a commercial product, and it's become a worldwide phenomenon now. The thing I'm most proud of as a patent never came to commercial use, but it did change how people think about doing shoulder replacement surgery. Back in 2005 or 6, we developed a tool that could tell the surgeon before the surgery what the anatomy was before the pathology. So this concept of understanding pre-morbid anatomy from pathologic anatomy was a major breakthrough. Florida is a pretty vibrant community relevant to research, innovation, development of new technologies. They've developed innovation districts throughout the state where there's partnerships to cluster centers of excellence. I look for opportunities as head of research and academics to improve that infrastructure. I think the trends are going to be, how do we do robotic surgery, surgical navigation faster and less cost? There's a lot of data that comes from the operating room. All of that data can be used for artificial intelligence, create algorithms from thousands of cases to give advice to a surgeon to say, based on all of this information, these are things you should consider for this patient to get a better outcome. It's energizing. Most people go into medicine to make a difference. If you invent a new technology, a new treatment, you help people that you've never seen, never touched, never knew. And that's pretty powerful stuff.